Welcome, Black Hills. It is March 15th, and today we have on Mr Willett from the Pennington County Emergency Management. Right?
Yep, absolutely.
Okay. What is it exactly you guys do?
So that's a fantastic question, and one that we get asked more often than not. So a lot of folks might know that something called emergency management exists, but a lot of folks don't really know what that means. And words matter, semantics matter. Obviously, in the situation we're in, semantics matter. Yeah. And one of the reasons that people don't know what emergency management means is we really don't manage emergencies. So,
yeah.
That makes it kind of tough. So emergency management exists in a community, at least here in Pennington County, for when situations arise that our local resources can't handle, when they become overwhelmed, or when they begin to become overwhelmed. So normally we've got fantastic first responders, we've got fantastic public works, fantastic transportation infrastructure. The county really has a lot of good things going for it.
Yeah.
But there are certainly events and instances, things that can happen that push the community over what it's capable of dealing with. And as soon as we start getting towards that tipping point, as soon as the community starts not having enough things to take care of the problem at hand,
yep,
that's where emergency management comes in.
Like this here with the coronavirus.
Well, so an outbreak of infectious disease can certainly get us to that point. In terms of where we're at right now, now granted this may change in a week, this may change in 2 weeks, but where we're at right now is not really how to phrase this. So nothing is really broken in our community right now.
Right.
Our resources are not tapped out, unless you're talking about the retail stockers who are trying to keep toilet paper on the shelves.
Shortage, yeah.
So
hand sanitizer,
yep,
rubbing alcohol.
But when we look at so one of the most significant concerns in a infectious disease outbreak is what happens to our healthcare infrastructure.
Right.
Are our clinics, our hospitals, our nursing homes, that medical infrastructure that keeps us safe. That's kind of the foundation of our safety and security in the community,
yeah,
in addition to the other public safety entities. But is our healthcare system doing okay? And everybody is concerned at this point, and everybody's talking at this point, but things aren't broken. We don't have patients stacked up in the hallways. We don't have lines outside the front of clinic doors.
What happens if it comes down to that, you guys?
So we're certainly in the planning stage of that.
Just preparing.
Yep. So emergency management and right now, all the right stakeholders, truly, we live in a dark place. We live in the what ifs. So
yeah,
the old adage of hope for the best, prepare for the worst really does apply. So we hope that it never comes to that point. And honestly, we don't necessarily expect it to come to that point. However, head in the sand is not a valid planning strategy. So we do have to ask those hard questions. What if?
Yeah, you got to have that balance between acceptance and denial in situations like this with it. Like,
yep,
you have
absolutely
to be aware, but then also not freak out.
Yep.
Yeah.
There's lots of little cliches. Cliche is probably not the right word. Idioms out there. Prepared, not scared, and some of those type of catch lines that the world listens to things in sound bites. And
I think it's very normal if there are people out there scared. It's just caution, basically, for something like this. If this is the first time, this is actually the first time a generation have seen you getting stocked, like the no toilet paper, being advised to stay at home, don't go in Publix, restaurants, gyms. So yeah, it's not normal. It's like nobody's been used to this. This is new,
Absolutely.
For some
Absolutely.
people, for the president, for the mayor, for the governor, for you.
From a and I don't even want to use the word pandemic.
Pandemic
really speaks to the geographic distribution of the impact of this. Mm-hmm. So not necessarily so much the severity. So using pandemic as a word, unfortunately, elicits sometimes an irrational fear in people, and that really is the crux of what we are dealing with is people's apprehension and fear, and a little bit of apprehension and a little bit of fear. If it motivates you to take appropriate steps to prepare is fantastic. But if that fear and that apprehension become excessive or irrational, then we breed more problems and more significant problems sometimes than the event that's causing that fear and apprehension.
Yeah, too much. Yep. People just, there's elderly out there, people with newborns that need wipes and stuff that can't find any because everybody's buying them out. And that's a very big time right now for companies that do have food and stuff to deliver home. Companies like the news also to put out facts, because there's so many websites and everybody's making their own beliefs because they want to believe something. So, and that's why we need more of the city to, distribute these facts.
Yeah, we were visiting, a little bit before we hit the record button.
Yeah.
That one of the challenges with this particular with SARS-CoV-2 and COVID-19, one of the challenges is the guidance is being updated hourly, if not daily. And one of the problems is good, hard science about what this means to people in the United States. The numbers, the data that we're looking for sometimes just doesn't exist. People are asking fantastic questions. And unfortunately, the science, the data-driven answers to those questions a lot of times don't exist. And so when you have that vacuum of vetted, verifiable, peer-reviewed answer, data, when you have a vacuum, lots of things fill that vacuum. People's fear, people's apprehension fill that vacuum. The other thing that fills that vacuum, and again, not to be dismissive of anybody, but there's a lot of talking heads out there, and everybody with an opinion. Everybody with an opinion will give that opinion, and there's plenty of platforms around for people to express those opinions.
Yep.
And then there's no facts to refute. So if you have 10 people on major networks giving potentially
their opinion,
contradicting opinions or ideas or forecasts, there's really no hard data to push back against that. And so it breeds this, it breeds more apprehension and fear in the public because officials and professionals who are supposed to have the answers just don't have them to give.
Yeah, not yet. And it's bad when you're stepping up and you're saying, we don't have it yet, because the public wants it.
Yep.
They want to feel safe. They want the answers now. There isn't a cure for this virus yet. They want it. They just did their first trial today, so they're waiting for answers. And that's the thing about this platform, is I'm not going to put my 2 cents in and just confuse everything. So I just want to hear from the real professionals and everybody, and get the point across that what's a way that everybody could prepare.
It's a fantastic question. So speaking specifically to, again, SARS-CoV-2 and COVID-19, my office isn't staffed by epidemiologists. So when it comes to originating content or originating protective measures for this specific pathogen, we're a mouthpiece for South Dakota Department of Health, and in turn, Center for Disease Control and Prevention. So the CDC and South Dakota Department of Health, when it comes to specific, hey, what are we supposed to be doing? We just amplify their message because they're the professionals. But you asked, what do you do to prepare? And that's a fantastic question. So my office doesn't necessarily look at, hey, what's our COVID-19 plan? Or even what's our tornado plan? Or what's our flash flood plan? Rather than looking at, because where do you draw the line? How many different disasters, how many different events can happen?
Yeah.
And if you have a plan on the shelf for everything that can happen, you're going to have a lot of shelves, and just not enough time to plan for that. So what we do, again, getting back to that question of what do we do to prepare, we look at capability building. So if we take, for example, what's a good example of this? Sheltering. So let's talk about public sheltering. People, for some reason, are displaced from their residence and have to be sheltered someplace. So
getting stuck in your home.
Well, or even outside of your home.
Oh, okay.
mass sheltering. We need to bring a bunch of people together. Think, the sports domes during Katrina. Where lots of community members packed into one place. So I'm just using it illustratively. So my office doesn't necessarily care what caused the need to shelter, whether it was a massive wildfire, whether it was a widespread flood, whether it was a tornado.
Yeah.
It doesn't matter what caused the need. For each of those, we still have to shelter people. So
Right.
we focus on sheltering, not a tornado plan, not a flood plan or a fire plan, but a sheltering plan.
Okay.
So we look at the big pieces, the capabilities that we can then leverage against any type of disaster that would occur. And so in preparedness, it's exactly the same. What do you do to prepare? Well, some of the same things you do to prepare for COVID-19 are exactly what you would do to prepare for, again, a flood, a fire, again, take your pick of the events that are out there.
Biological.
Yep,
Outbreak.
absolutely. So preparedness, and this is where we get into some of those sketchy things of how much preparedness, because right now we've got people taking things to some degree of extremism.
Yeah, they're probably stocked up for too long.
And to be fair, again, you look at some of the doctrines that are out there, and our office really promotes the 3-day preparedness.
Oh, okay.
Well, 3 days is great, but in this particular event, in a prolonged, when people are talking 14 days or 8 weeks, that's crazy.
Yeah.
3 days of preparedness isn't going to get you very far. But there are doctrines out there that say, hey, 7 days or 14 days or 30 days worth of preparedness. But a lot of us don't have the financial means or even the real estate to store 30 days worth of everything you need. So that can be tough.
Yeah, for the regular resident around here in the Black Hills, they should, at least a couple weeks, you think?
I would say it depends on your individual situation.
Yeah.
So if we can bring everybody to a baseline of, say, 3 days, if you have 3 days worth of food, 3 days worth of water, 3 days worth of medicine, 3 days worth of diaper, 3 days worth of formula, 3 days worth of pet food, all those types of things, we can build from there. But bringing everybody up to that level really, really, really helps.
Yeah.
When it comes to things like water, again, you have to look at your individual situation. So if you're within the city of Rapid City, if you're on the municipal Rapid City water system, that's an incredibly robust system.
Yeah.
Something really, really weird would have to happen for citizens in Rapid City to not have drinking water. But you get up into some of our hills communities, and maybe that situation changes.
They'd
Maybe
have
the
to
system
stock up.
isn't quite so robust.
Wells.
Yep.
Yeah.
So it really is individual, but it's a matter of looking at all the really good checklists that are out there and thinking about things like, again, dog food, medicines. Medicines are one of those things where, and a lot of this comes down to, including what we're seeing right now, is supply chain. And one of our largest concerns with this particular event is the medical supply chain. Are we going to have the right personal protective equipment for our hospital providers, our medical providers, to do the job that they need to do? That's concerning.
Yeah.
But supply chain also affects pharmacies, pharmacological medicines, pet food, obviously toilet paper, those types of things.
Having to go out in something like this too and get it. People are,
it kind of defeats the purpose.
Yeah, right now people are kind of scared to go out, even to the grocery store, to get something. There's security everywhere. Things are just flying off the shelf. For like a regular resident, they should probably prepare just for those 3 days.
Well, it's a baseline. If we're talking about this specific event, if we're talking about SARS-CoV-2 and COVID-19, 3 days is probably not going to cut it. You probably want a longer term,
couple weeks at least for now.
It'd be fantastic if you had enough dry goods, if you had enough, toilet paper, but
rice, beans, some dried stuff.
Could if and huge ifs, again, talking about the hoping for the best and preparing for the worst.
Yeah.
If somebody were to come by and say, you know what, I think you should self-quarantine for 14 days.
Right.
So self-quarantine doesn't mean run into the gas station every 4 hours for Diet Coke. Self-quarantine doesn't mean run into Walmart to pick up what you need to pick up. So,
Right.
so the question that this particular event begets is, if somebody told you, I think it'd be in your best interest and the community's best interest if you self-quarantine for 14 days, could you do that? With what you have in your house,
Right.
would you be able to do 14 days?
Okay. It might come down to that because it's looking pretty bad out there. They're going to start shutting down restaurants and bars, and all the community events are shut down. They're starting to come up with things to do at home with your kids to keep them entertained, and having mental health, not just focus on this whole thing the whole time. You have to step away, watch Disney or something like that. It's just you gotta still have positive thoughts. It's kind of scary, but you do have to push away from it a little bit for mental health.
Attitude is so key.
It is.
And so three. What we're going through. There's three things that always rise to the surface when I think about this. So supply chain, specifically medical. So how's our medical infrastructure doing?
Mm-hmm.
The other thing that rises to the top of concern is education and school. So suspending school is a big deal. You look at
Today's the first day. Yep.
You look at natural disasters across the country, and one of the doctrines of emergency management across the country is if you have a community that's devastated by a tornado, if you have a community that's devastated by an earthquake or landslide or hurricane, one of the primary things that they want restored is school. That's like the first thing you want to get back in a community is school,
education.
And so to push the pause button on school is a big deal. That's a weighty decision. So our healthcare infrastructure, our education of our kids, the schools, and then the other thing that rises to the top there is the economic impact of all of this.
Oh, yeah.
So supply chain, absolutely.
Yeah.
Kids staying home and parents having to stay home then to take care of young kids that don't have daycare. And if you're taking kids out of school, does that mean you're packing them into daycare? So,
Yep.
but really, when we look across the country and we see other states that are significantly limiting restaurant business and bar business, if we look at it through the lens, if we look at it through the eyes of stopping, or I shouldn't even use the word stopping, of limiting the spread of a pathogen, sure, you can make the argument that makes sense. But the question is when does the cure become worse than the disease? And at what point is the economic impact for a community or a family worse than what it is we're trying to prevent? And so in addition to talking to our medical professionals, in addition to talking to our school districts, it's a matter of, hey, who are the right economic people? Who are the economists? Who are the people that have their, because a lot of the times on economic drivers we look at permit values or sales tax receipts or these. Well, those take a little while to compile and come back. That's not a real-time pulse. The question is, what metrics exist in the community for us to look at our economy and know when something bad's happening, and then what do we do to respond to that? So really, those are tough questions. Again, just like my office isn't staffed by epidemiologists, we're not staffed with economists either. and so the question becomes, when do we know that our local businesses, we can assume, but when do we know when they're hurting and how bad they're hurting?
It's probably before it's too late.
Yeah, exactly. So what are the indicators? What are the indicators?
Right.
What metrics do we need to track to say, holy smoke? So, everybody by now should know, well, if you're febrile above 100.4 and you got a dry cough and shortness of breath, it's
probably
time,
too late.
It's time to make a phone call.
Yeah.
So that's kind of been beat into people's heads. We get that indicator. We get those signs and symptoms when it comes to our health. And I would say maybe not equally, but I'm certainly concerned about what are the signs and symptoms of our local economy. When do we know when our economy's sick and when we need to take some steps to keep that?
There's some things they can actually do, especially right now, is curbside delivery. Just take it there in the bags, drop it. They can pick it up. Mm-hmm. Everywhere can do that. Restaurants, instead of having everybody come sit in, prepare it curbside or delivery for now. Get the wait staff working and just drop it off at the door. Don't go in. Just drop it off at the door. They can pay online or whatever and head out.
Yeah, all those ideas have a tremendous amount of merit, and those are the types of out of the box thinking.
Yeah, I think they really need to start that. Like I watch a lot of businesses around here. They need to start doing that. Like, keep everything going economically,
or hopefully at least they're planning what that eventuality looks like.
Yeah. When this podcast comes out, they'll hear it.
There you go.
Get the idea.
There you go. But those are the types of things. How do you keep, how do you keep the community a community? How do you keep the community functioning?
Yeah. Community also, as a whole community, we need to keep, the more precaution we do take, it's not freaking out. It's not overreacting. As long as we're all safe here and we keep it down, keep the numbers down, then it does seem like we're overreacting. But actually, we're taking really good precautions. Everybody just grabbing your supplies and staying inside. It seems like overreacting, but then if it spread and there was, 50,000 deaths here, we'd be like, oh, maybe we should have done something different. But as a community, those families without toilet paper, low on food. Maybe some people here in the community, we could start helping each other out here, because there's bigger cities that are just people are hoarding, and then there's so many people without it, and some people don't even care. They're not even taking action. They don't believe it. They're in that denial, but they're probably spreading it.
Yep, that's true. So, yeah. South Dakota is an awesome place to be, an awesome place to live. Sometimes we misstep. Sometimes we'll clean out a shelf of toilet paper for no good reason. But by and large, we're pretty dang good at neighbor helping neighbor.
Yeah.
I'm hoping that this initial, level of apprehension and fear, I hope that diminishes a little bit. People get their heads screwed back on straight.
Yeah.
And
go about it better.
Realize
if it happens again.
Well, and one of the talking points is, and I might get some epidemiologists mad at me when I say this, but so Rapid City in Pennington County is not Wuhan, China, and it's not northern Italy, and it's not New York, and it's not California, it's not Washington.
We have a population of 800,000 or something like that, which is
so
not even the size of a big city.
Yeah, you look at our population density, and even population density is probably one of the most. I'm counting how many times I touch my face, but population density is one of those things. But again, we have our own idiosyncrasies. We have our own strengths. We have our own challenges and weaknesses. But the nice thing about Western South Dakota is when challenged, most of the time, and it can take us a little while to find our stride, but most of the time, the community, the people, rise to the occasion.
Yeah.
And I have confidence and faith in the folks that we have here to do that, to take care of the community, to realize that it's a serious issue. It's something we have to be cognizant of. It's something we have to prepare for, and it's something we have to respond to. But we do that in measure, and we do that our way in Western South Dakota, and not necessarily be driven by national level or global level politics.
Right. Yep. We are in the Midwest, and we're surrounded by the Black Hills, so we're kind of isolated.
And that strengths and weaknesses. So we are relatively isolated. So we as a community, we are relatively self-reliant. We've built a lot of capacity because we don't have a big city neighbor to borrow resources from.
Yeah.
So the fact that we are somewhat geographically isolated has strengthened our position and our posture when responding to large-scale disasters or emergencies. The challenge, though, lies in, and we touched on this earlier, but to flesh the idea out a little more, supply chain. So supply chain globally, let alone nationally or even locally, they run lean. People don't make more than they're selling. There's not warehouses, stacked
ready to
floor
go
to ceiling with stuff. So this supply chain runs lean all the way from source material to retail shelves.
Mm-hmm.
And when you run that lean, any disruption in that supply chain obviously has second, third, fourth order consequences, and you can disrupt that supply chain relatively easily. And then you look at a place like Western South Dakota, where we don't have a lot of food processing, and we have a lot of raw resources. We ranch, we farm,
Yep.
We have timber. And we do have some sawmills, but again, end products, we typically take the raw materials, send them somewhere, they get processed into something, and then shipped back.
We actually get a lot of products from China too.
Yep, absolutely. So, we bring most of what we need. We don't have a lot of compounding, pharmaceutical compounding in Western South Dakota. We
Right.
don't make our own medicines. Those medicines come in from other places.
Yeah,
Medical supplies come in from other places. Most of our groceries come in from other places.
Mm-hmm.
So that supply chain, our isolation builds capacity and strength, but it also puts us at
There's
risk
a fault
for
for
supply
everything
chain.
coming in.
Yep.
Also, yeah.
Yep.
Yeah, I never thought about that, how everything is shipped in from everywhere. And that is kind of bad. Like when it's not in your own, we need to get on that industry-wise.
Yeah. Well, and so you look at groups like Elevate Rapid City,
Mm-hmm.
and other larger groups, because it's not just Rapid City; it's the entire area. It's Pennington County. It's all of our.
I hate touching my face, but
Yeah. It's all of our municipalities, but that's one of those value-added plans of how can we make more stuff here. We have great resources, good natural resources, but we ship it all out.
Yeah.
And can we foster, can we incubate industry here, where we're making stuff here with the stuff that we have? And that's absolutely a strategy that certain folks have pushed and hopefully have some measure of success with.
yeah. So with the Pennington County Emergency Management, do you guys work with the hospital at all?
Absolutely.
Yeah.
So my office, in terms of day in, day out operations, we have 3.6 people, and the 0.6 is I share an administrative assistant, although she's the glue that holds the whole thing together. But there's only 3 full-time people in the office. So if you think about force multiplying, 3 people are just 3 people. We can't do a whole lot of
a lot of
boots
work.
on the ground work. So what we do is we leverage relationships. We build, sustain, foster relationships. So
Okay.
it's a matter of the answer is absolutely we work with Monument Health.
Yeah, Monument.
It takes a while to make that transition.
Yeah.
But our role in the community comes from building those relationships and leveraging those relationships. I shouldn't say leveraging it. It sounds like we're using it for something.
Right.
So it's and I hate to use buzzwords, but it does come down to that sometimes. So one of the huge things my office does is what we call shared situational awareness. So situational awareness is what I know. It's what my senses are telling me, what my data is telling me. So I have my own situational awareness. I know what's going on around me. You have your own situational awareness. You're smelling different things, seeing different things, hearing different things. Your situational awareness is different than my situational awareness. When we get together and share our situational awareness, we build something called common operating picture. My office exists to try to build that common operating picture. Okay. So I want to know Monument's situational awareness. I want to know the fire department's situational awareness. I want to know the community of Wall's situational awareness. And not only do I want to know that, but I want Wall to know what Keystone is doing. I want Keystone to know what Hill City is doing. I want Hill City to know what Rapid City is doing. So once we build this common operating picture for Pennington County, then everybody knows kind of at some level, not intimate details, but at least at a high level, everybody understands what everybody else is going through, what they've done, what some of the best practices are, what the challenges are, and maybe somebody says, "Oh, you know what? I've got a solution for that." And again, we
relay
build.
it.
Yeah, we build. A positive momentum with sharing all that situational awareness and creating that quote unquote common operating picture.
Does every community around the Black Hills have emergency management?
So, South Dakota state law, codified law, mandates that every county have an emergency management program and an emergency management director. So that looks different in different counties. So emergency management isn't always exactly the same. I'm very, very fortunate in our office that we have 3 people. There are plenty of counties across South Dakota where it's a quarter-time or half-time position. The person might be the county auditor and the emergency manager. We have a lot of places where the sheriff is also the emergency manager. So there's a lot of different models out there.
Yeah.
We're really, I think, we're very, very fortunate in Rapid City and Pennington County that we have full-time staff dedicated to the role.
Are they all around the community? Are they all stepping up? Are you guys elaborating, like talking together and stuff?
So, not as good as we should be. There's always room for improvement.
Yeah, right.
There's always room for improvement. So, starting tomorrow, actually, we're going to be facilitating a county-wide conference call where we're looking for stakeholders. So, again, the buzzword that we use is called whole community. So, it's not just government organizations. It's not just public works. It's not just public sector stuff.
Right.
The whole community is the faith-based community, private nonprofits. We use a term volunteer organizations active in disaster, or VOADs. You look at your Red Crosses, your Catholic Social Services, Lutheran Social Services, Salvation Army, Mennonite, all those folks. So really we're trying to foster, again, that shared situational awareness, but the stakeholders that we're trying to bring together on the call are hopefully representative of the whole community.
Okay. Yeah. Come up with a plan. You guys got a plan coming up? Come on, lay it on me.
We got plenty of plans. And again, it
for COVID.
Contingencies. And really, just like I started out with, we don't necessarily have a COVID-19 plan.
Yeah.
We have capability plans. How do we deal with a lot of patients? In the medical terminology, surge. So if we get a lot of patients surging our medical facilities, do we have a plan for surge? Yes, we have a plan for surge. Is there a plan for isolation? Yes, there's a plan for isolation.
They get the drive-through now at Monument for the COVID testing. And do you know how they do the testing?
A nasal and oral swab.
Oh, yeah. I did not know that. I saw that on the news, and they take that long swab, shove it in your nostril, and then all the way to the back of your throat. So if you think you're just going to go get an easy test, it's not an easy test.
Well, and here's another thing is if you think you're just going to go get a test at this point, that's not the case.
Right.
And so again, that's one of those problems is we see media reports from across the country of, hey, we've got these roadside stations set up in these other states where people literally can drive up in their cars and get a test. In South Dakota right now, that's not happening. So we have a very limited number of tests available currently. And again, that might change next week. That might change the following week. But as it stands right now, we have a very limited number of tests, and we're being very prudent through Department of Health guidelines on who gets those tests. So it's kind of a misnomer. It's kind of misleading when we say Monument now has a drive-through testing facility. Yeah. Well, it's not the public at large thinking that they want to get tested and driving through and getting tested. You still have to meet a very specific, rigorous criteria and have a doctor's order to get tested.
Okay.
And so people see that Monument now has drive-through testing right after they see the national news that Colorado or Rhode Island is having these hey y'all come parties.
Mass testing.
And that's not what we're doing here yet. So again, that can contribute to some of that confusion or confusion's the right word for it. So.
Yeah, it's there's not a lot of elaborating on what's going on and it's so fast. Yeah, it is. What is this? 65 days in for this whole thing, this pandemic. But 65 days in, there's no cure yet. The people are buying up everything. It's chaos out there. There's fights at the grocery stores. And with the medical field, they're just doing their job. They're, going, whoever comes up with a cure, then they'll get it, but they're just doing their jobs, the people on the front lines. And shout out to everybody who's on the front lines, like, the first responders and nurses, doctors, you guys.
Yeah, there's people that we call those community lifelines.
Community lifelines,
So
I like that.
it all comes down to infrastructure and what are the community lifelines? What things in a community need to be there? What people need to be working in order for you to have a community?
Yeah.
Because if we're all just holed up in our houses, that's not much of a community.
Right.
It takes more than that. People take their clean water for granted sometimes. People take the ability to flush a toilet for granted sometimes.
And with all this toilet paper going on and all these wipes and stuff, it's going to start a problem with the plumbing. And there's only plumbing jobs isn't what they used to be. It's not a big boom, and all the younger kids don't want to be plumbers. So if something goes wrong with somebody's plumbing, you're probably going to be out of plumbing for a while. It's going to be a list, because I guarantee they're going to start breaking pipes.
Certainly a concern. So you see messaging from sanitary sewer systems and operators,
municipal,
absolutely saying, "Hey, just like always, don't flush anything down the toilet except toilet paper."
Yeah.
And now it's more critical than maybe other times, because people have the potential for getting creative. So the bottom line is, don't get creative in what you're flushing down the toilet.
What do you think that's going to do for the biology though of the dump, because they're going to put it in their trash, and then the dump guys are going to come get it, and then they're going to take it to the landfill, and that's just going to be an overabundance of people's booty wipes out there. It's going to be a lot. That's never been dealt with either, is a lot of that stuff, because that stuff does fly around.
Yeah. I will say that, microbes make the world go round. So, landfills rely on some of those microbial colonies to decompose that waste and break it down. When you get into a question mark, when you get into an unknown, when you get into, and the word that we're obviously throwing around over the last couple months is novel. When something is novel, when something is new, when you're presented with a situation that you haven't necessarily been presented with before, there's a lot of really good questions, and it can be challenging when you are in a role where people expect answers, to honestly look at somebody and say, that's a dang good question.
I don't know, man.
And I don't have a good answer for you.
Yeah.
But I can say with a great deal of certainty, in the decades that I've been a part of the public safety community, that we have good, capable people. So we might not know what tomorrow looks like.
Yeah.
But I'm relatively certain that we have the right people in the right places, with their heads screwed on straight, that will be able to deal with. I mean, it's not all roses, but
I'm just glad I get to ask the questions.
we'll be able to deal with what happens when the sun comes up tomorrow.
Yeah, one problem at a time, but there's going to be a lot of problems.
Yep,
just saying.
Absolutely. And again, not to trivialize COVID-19. It's concerning, and not to trivialize the disease again, but really some of the greater concerns right now isn't necessarily the pathogen as much as it is the people. So there's certainly health concerns, especially for our at-risk population. So the at-risk folks certainly are concerning, and we certainly need to do everything we can to protect those people in our community and limit the spread of that pathogen. But at the same time, a lot of the issues that we're currently trying to work through, a lot of the issues that we're dealing with, aren't caused by a disease or an illness or a pathogen. They're caused by people and apprehension and fear. And so managing that people part of this, pretty much impossible, but really, we're really hoping that people can settle down, screw their heads straight, and make good decisions.
You got any tips for the community around here to be a better, stronger community during this time?
So understand that there are those in our community that are at risk. And some of those at-risk populations are also our disadvantaged populations. And we are geographically isolated, and there are limited resources. So when those of means and those that are more affluent, and I use the word hoard cautiously, but when we
hoard,
when we
bulk.
take more than what we need.
Yeah.
From the limited supplies that are coming into the community, we really do run the risk potentially of
Hurting more of our
keeping
community.
those supplies out of the disadvantaged population who might be more at risk to the disease. And so, again, compassion
Yeah.
and a reasonable and rational approach to this. It doesn't mean you don't prepare, but it means you prepare within reason. And understand the other thing, and this gets hard because it's not definitive. There's not a this side of the line and that side of the line. It's this weird gray squishy middle area. And that is, we really need to evaluate, and this is kind of again on the economy and the economic side of things, we really need to evaluate if the solutions we're coming up with are potentially worse than the problems that they're designed to solve.
Yeah.
So we need to look. I talked earlier about whole community.
Right.
There's multiple components that make up a community. Well, there's more than just a pathogen threatening the community. There are a lot of other things that go into keeping our community healthy. And if we focus solely on one threat, if all we're looking at is COVID-19 and we exclude everything else,
Yeah.
we run the risk of fixing a COVID-19 problem and creating 2 or 3 other problems that were worse than the original COVID-19 problem.
Yeah, that's a hard balance.
It is.
To balance out avoiding the spread of the COVID-19 and then also playing your part in the community, like, because the community is an organism too with everything. So it's a very hard balance. Like, that's, yeah.
The other thing that's hard to wrap the head around sometimes, and we've been there for a long time internally. Again, it's a tough message and it's a tough strategy. But we really look at mitigation, not containment. When you look at spread of disease, it's pretty hard to contain the spread of disease.
Yeah.
And so really what we look at is, what are our mitigation strategies when people get sick? How do we deal with that?
Yeah.
So yeah, it's.
What are you guys going to do?
No
when
easy
people get sick?
answers.
What are you going to do?
No easy answers. Going back to I love the military, love our military.
Yeah.
And there's some relatively elite branches that say the only easy day was yesterday. So
That's true. Yeah.
so again, I just come back to I love this community. I'm proud to be a part of this community. And people will get their heads screwed on straight and do the right thing.
Yeah. I hope the best for everybody out there. And I don't know if everybody has, well, some people have overabundance of supplies, and there's a lot of elderly out there that need it. There's a lot of elderly that are actually don't have any supplies.
Mm-hmm.
So yeah, if you guys have overabundance of supplies or something like that, message the studio, message Black Hills Podcast, and I'll make sure that it gets to the needy, the elderly, parents that have newborns, stuff like that. If you've had too much, we can, you can either drop it off and be, I don't know, discreet, not know who it is if you bought a lot, but we'll get it out there to those that need it, because this is a time where we need to look out for our neighbors and everybody.
It's tough when you talk about isolation and quarantine and social distancing when really our strength lies in who we are together and community.
Yeah.
So
Yes.
those words, again, words mean something, and they're kind of at odds when you talk about social distancing and you talk about quarantining. But again, our strength is in our relationships and in our community.
Sorry for shaking your hand when you came in.
I don't. I've been telling myself to get into the habit of doing the live long and prosper thing. just something.
There you go.
But and I'd be remiss if we didn't mention the fact that basic hygiene in limiting the spread of
Shaking hands,
Any bug.
coughing,
Yeah.
coughing to your elbow. What they say, And
Well, the best thing is to cough into a tissue and immediately throw the tissue away. Sneeze into a tissue, immediately throw this tissue away. But yeah, if you don't have a tissue available, cough, sneeze into your elbow. Avoid shaking hands. Again, that really, really close contact, close prolonged contact. Be cognizant of that. Those are solid facts. We know that's we know that those are very, very, very effective strategies in limiting the spread of pathogens. So,
yeah, they say if you're having a conversation too, you should be at least 3 feet apart.
Yep.
Or if you're sitting next to someone, 3 feet apart. There's no more. That's the baseline for distance is 3 feet.
Yeah, some droplets are not our friends. So.
Yeah, no sneezing.
No, yeah.
But we are 3 feet apart.
Absolutely. So.
Alrighty. Well, thanks for coming in and thanks for sharing.
Well, thanks for having me. Hopefully the listeners get something out of it. And
yeah.
And again, it's prepared, not scared.
Prepared, not scared.
It really is that simple.
If they have some fear though, don't be ashamed. And if you get a leaky nose or a little cough or something like that, don't second guess it. Take it serious. Call the hospital. There's multiple numbers set up at this point. Don't just self-present. Don't just show up. Call. Yep. And there's really, really smart people with really, really good training who will ask the right questions, get the right history, and probably be able to put your mind at ease. And if not, get you to the right resources. Yeah, Black Hills Regional Eye Institute. When you come in, they meet you at the door. They ask you all the medical questions. If you have a cough and stuff, they'll check your temperature before even entering. So that's really good on their part. And I hope more places start doing that because, there's, we need to take it serious, and then a safe amount of denial also. That keeps us sane.
Yeah, sanity would be good. Sanity would be good.
Absolutely. All right.
Awesome. Well, thanks for having me, man.
Anytime. You get some more information or anything, want to come share it, go ahead and come on.
You bet.
All righty. Bye, Black Hills.
Thanks.